the great Dr. Margaret Goodman. Margaret, thanks for coming on the show today.
Thank you for having me. Boy, that makes me tired just listening to that.
Oh, yes, you're very decorated. We are so glad to have you. Why are you laughing, Margaret? Tell the people what you're laughing for.
It was just so much. It was like not necessary to hear all of that, but I appreciate you saying it all.
Oh, absolutely. You're so welcome. So, Margaret, I know that we don't have a lot of time with you, and I thank you so much for donating and investing your time with us. And I know we have limited time, so I don't want to go all around the board. We have people in here watching all around the world, and they are so excited in the chat for you being here. So let's start it off real quick, Dr. Margaret. And I know you told me not to call you doctor privately, but I'm going to do it for the sake of the audience, if you don't mind. How did you get into combat sports in the first place?
The same way that I think most people that work in the sports, such as yourself, I was just a fan of it. And when I moved to Las Vegas, there was so much of that going on that it was something that took my interest, and I found it a way to take care of patients that were a little bit different from my general neurology practice. And so I really enjoyed working with fighters. It was something that really changed my mindset on medicine. And it was an honor to do it for as long as I did on that direct capacity as a ring physician.
Margaret, some people remember you, and I told you this privately, and I'm talking about, I don't know, 15, 16 years ago, a very long time ago. You've conducted a lot of interviews on the HBO special Legendary Nights at the Fights. You recall that, right?
Yeah, of course.
Sure. And you gave a lot of evaluations as a neurologist when fighters like Riddick Bowe and a hometown hero here in Philadelphia, Meldrick Taylor, had some chronological injuries after a series of fights. Can you give the audience some education on your experiences as being a neurologist, a ringside physician, watching the fighters deteriorate fight by fight by fight with some neurological damages that they suffered?
Well, I'm not exactly sure how you want me to approach that, but bottom line was and is that I think that by the time we start to see changes, it's already too late, so to speak. And the question becomes, which has never really been completely answered, although I know there's those doing research on it, is how do you catch those individuals before it gets to that point? And, obviously you named two big examples, which, I think most of the people that listen to or watch your podcast can understand because they're flagrant. They jump right out at you. But the issue becomes more difficult when you're looking at fighters close up on a frequent basis, and then in working with a commission, the way that the sport is regulated makes it very difficult to intervene before it is too late. And so that's kind of what we tend to see, and there's a center, and you probably have known about in Las Vegas, called the Louisville Center for Brain Health, and they've been conducting fighter studies for the last several years, in addition to looking at the NFL athletes as well. And, I guess that there's no exact test that will tell you prematurely when somebody is susceptible to chronic brain injury. And the bottom line is the more you get hit, the more risk you have. And then there's a whole bunch of other factors that enter into that, such as heredity, genetics, your physical makeup, how often you spar, how often you compete, how often, what time you take off in between. And so it's very difficult the way the sport is regulated to make a big dent in that. And I think things have improved, but nowhere near where they need to be.
Right. And you also have publicized some of your concerns. For example, when a professional fighter, whether it be MMA and or boxer, we see that their face get disfigured. I don't know the, correct pronunciation of it, but when we look at a professional athlete who's in the ring and they look, healthy, regular, and then by round 6, round 8, round 10, and sometimes even at the end of the fight, round 12, since we were talking about Meldrick Taylor, this is one of the telltale signs that we saw face disfiguration. You did a tweet, and I just wanted to read it back to you as I was conducting research, and when you mentioned the tweet, and your tweet, this was posted January 18th of 2023, last year. You posted, I believe it was on X, formerly known as Twitter, and you basically said, it's what you don't see that can hurt you more. Facial disfigurement is not the only injury. Changes that may be happening to the brain that take time to develop. And in all capitalized letters, you said no physician attending can adequately determine extent of injury. Can you break that down a little bit about what that means in layman's terms for the audience?
Well, bottom line is, what you're seeing, if you're getting trauma to your head and your face and you're bruised and swollen eyes and cuts and all that kind of stuff that you're seeing watching a fight, it's impossible to know what's going on inside the skull. But people tend to too often to ignore the fact that what you're seeing on the surface, such as facial changes, and you may not even see that much. It depends on the person's anatomy as well. But those particular changes, they could be worse or better or the same inside the brain. And so after a fight, it's almost impossible. No fighter gets a scan after every fight. Well-known fighters will often, that have the funding, can have serial scans done on themselves. And I know some famous boxers that, have the income to afford that will get checkups like that on a regular basis. So whatever you're watching on the surface, who knows what's exactly going on inside the head. And then the issue becomes, how often is a fighter really suffering concussion? And then the exam that we all try to do, sometimes immediately after a fight or when a fight is stopped, depending on how it's stopped, you can't really necessarily predict how much injury someone has really sustained. So it can take time. Obviously doctors do a great job and evaluate a fighter in the back, but that can be limited as far as telling you, have they really suffered a concussion that needs more time off than the automatic suspensions that a fighter may get. And so most of those fighters, I'd say probably 95% or even up more, never see a doctor until they're, forced to for a pre-fight physical or medicals that they have to submit for their next combat event. And so no one really follows them. And sometimes the people that are closest to them don't understand what questions to ask. They may chalk it off to the fact that someone's lost and they're depressed and sad, and they may not recognize that these are signs of a concussion. So I think the bottom line, you see this with the NFL when they've had some injuries, they've taken athletes off of the field and given them some time off, which probably is not sufficient. But at any rate, that's their rules. But you wonder how, boxers themselves and MMA fighters don't necessarily have that follow-up, and they may not be able to tell on themselves. So it becomes a difficult thing to determine.
Right. And you also mentioned proper suspension days. When you were a ringside physician, and of course, I know the protocol, but most of the audience do not. With regards to protocol, let's say after a professional boxer compete in the ring, obviously there's an evaluation, particularly if a fighter gets knocked out or technically knocked out, so to speak. What is the process before the professional boxer gets suspended? 30 days, 60 days, 90 days? How does that process work?
Well, and I don't know the exact days anymore. You would have to check the regulations per the Association of Boxing Commissions, as I'm sure they have it listed. But there's a certain number of days depending on how many rounds a fighter competes in. Obviously, it's a little bit different for MMA because they don't fight the number of rounds for a championship bout like a professional boxer. So there's a certain number of days, and it may be 30 days. But on top of that, the ringside physicians can make a determination as to a lengthier suspension depending on what happened during that fight. Even if they were the winner, it was a very tough fight. They may say this person can't come back and compete in the U.S. and you hope that internationally it's observed, but it's not always, that they can't compete for 60 days or 90 days, or they need to have specific medical tests performed before they can come back and compete. And the issue in that is that the tests don't always show you, whether or not someone has fully recovered or not. And a lot of it can be on someone's personal history that they gave. And as you know, fighters are strong-willed and don't always want to admit that they still have symptoms, such as a headache or dizziness or memory loss or balance issues, difficulty sleeping, all those different entities that can be present in a post-concussive syndrome. They may not discuss those, even if they're asked by a medical trained, by a physician or a physician's assistant. And so then they can come back and train too soon. And as you know, and I'm sure you've discussed this before, is most of the injuries that fighters take and most of the punishment is in the gym when they go back and start sparring again. So, that's a hard thing to gauge. And so you hope that the people that are working with the fighter have the fighter's true best interest in heart. That goes along with their coach and their trainer and their family to say, enough is enough for now. Let's get some more rest. Don't take a fight on this time period. But, money talks sometimes and fighters don't have a lot of opportunities.
Yeah, yep. And that's usually how it goes, unfortunately. So fast forward from your days as a ringside physician and the chief and being on the board, you had this knack of of cleaning up the sport, being a part of anti-doping. You were on record in several interviews before where you talked about horses, and I'm sure you love horses and
yeah.
the way that they get tested. Can you give us a little backdrop on your motivation of starting VADA and your story of horses? And what did you discover when your friends took you to the horse racing?
Yeah, and I've talked about this before, as you've mentioned, but I think that one of the things that gets ignored, I mean, there's so many things that get ignored for fighters, which is, unfortunate and unfortunately based on funding most of the time. But one of the things that gets ignored is substance use, and it can be performance enhancing drugs, it could be stimulants, narcotics, and all those different things that fighters and the people that work with them aren't always educated enough on what's dangerous, what should be prohibited. And when I had stopped being a ringside physician, I but actually had a friend who was with one of the big racing commissions at that time as their attorney, and worked with the Attorney General's office. And so basically, I went and visited him and saw that the thoroughbred horses, I can't speak for some of the other events, but that they actually were undergoing more drug testing than fighters were ever undergoing and for more substances. And so that kind of gave me the idea that, at least we needed to incorporate more of that in boxing and in MMA. And so that's how it kind of spun off from that point. And I think the main thing that still is an issue for most commissions, not so much internationally, but still internationally in most jurisdictions, but definitely in U.S. commissions, is there's no out of competition testing. So testing throughout the year, and that was a big problem and remains a big problem because that's when most athletes will use substances that are prohibited is during that time. So that's the other reason why we started this, was to educate the media, people such as yourself, the commissions, and definitely the fighters and even the fans about what should be done to try to clean up the sport. Because as you probably know, every single sport, it can be golf, tennis, cycling, or boxing and MMA, performance-enhancing drugs are a problem and remain a problem.
Oh, absolutely. So since you mentioned all year round testing, I'll just jump right there first. Most people consider it 365 24/7 testing, right? So
It should be.
it should be 365 24/7 testing. When was the first time that 365 24/7 testing actually happened in boxing?
You know, it only, well, there's two ways to look at it. Nonito Donaire was the first fighter that we ever had that underwent testing in that way. However, you need to understand that, for example, in the United Kingdom, even though they don't test that often, and also it's another issue for funding, anybody that's a professional fighter or a boxer, they don't include MMA, but a professional boxer in the United Kingdom is subject to testing throughout the year, and they do conduct testing. And so, you know, there's entities that do that. And then, of course, the WBC was very proactive and really saw that that was something that they wanted to enforce, and then required all of the top 15 fighters in each weight category to be eligible to undergo testing throughout the year. So that's the other thing that we have enrolled in. So obviously we, you know, if we had significant donations and funding, I'm talking about probably, I don't know how much, but significant amount of funding to test more of those individuals, we test those individuals throughout the year, and we show up and, you know, and we actually, I don't think I've ever had anybody refuse. I mean, sometimes it's hard to find them, but we haven't really had too much problem with that. The fighters usually let us know where they are, and they're subject to testing.
Okay. And I did hear you mention Nonito Donaire. The audience was told that you personally ordered Canelo Alvarez to undergo 365 24/7 testing. Is there any truth to that?
He did that for a period of time. I can't remember which exact year he did. He is, however, for many years now been enrolled in the WBC program and is eligible for testing through that as well throughout the year. Yeah. But he does testing for every fight he has, and there was a period of time where he underwent testing for a year. I just don't remember exactly what year it was. Okay. It might have been after the Gennady Golovkin last fight, I would think, but don't quote me on that one.
I got you. Okay, so when we talk about 365 24/7 testing, on average, as an estimate, how many times are fighters tested, or were the fighters who conducted 365 24/7 tested? How often throughout the year were they tested?
So the problem, I understand what you're asking, but it's not really done that way because, for example, in the WBC program, let's say there's 600 fighters enrolled, and some are volunteers to the program as well. They may only get tested once a year. They may not get tested that year, but they're eligible to be tested and know that that's a possibility. And then the WBC would adjudicate that. Adjudication is another problem, but for now, as far as how often they're tested, that's a different thing. As far as fighters that enroll for us leading up to a fight, sometimes it can be 5 months before a fight. Sometimes it can be, you know, a month and a half before a fight. It just depends. And so those fighters, depending on how long the time is that they're enrolled, they may get tested, or how many bouts they have through a year. There's some of those fighters that have fought 2 or 3 times a year. They've been in our program for, you know, 2 to 3 months each time. And so it's pretty much throughout the year where they're tested, and they may get tested a total of, I don't know, 18 times throughout the year. It just depends. So it varies.
Right. And the reason why I asked that question is, as you know, on VADA's website, and I made reference about this before my audience, so they are aware of this part, that on the website, on VADA's website, it spoke on fighters being tested 8 weeks prior to each bout that they'll have.
And that may be true, but it also can be, I should probably change that, but it can be a lot longer. So, for example, and I don't think this is talking out of school, but for example, Tyson Fury and Alexander Usyk were supposed to fight. I guess were they supposed to fight in? I can't remember if it was January or December, but they were supposed to fight. They had been enrolled in testing for several months before that, and we just continued the testing all the way through, and we'll continue it through their next fight. So it may be 5 months, 6 months.
Before they fight, you're saying 5 or 6 months prior to them fighting?
Yeah, it depends. It depends. I mean, that's just one example. There are others in that category as well, but it just depends on when they signed up. If the fight date got postponed, sometimes they'll. On the average, I would say most of the athletes that come to us are leading up to about. It's usually 2 months before. That's on the average. But there's ones that are 6 weeks before, and there's ones that are 3 or 4 months before. Just depends.
Right. Who pays for the testing, Margaret?
Typically, it's the promoter that pays for the testing. Sometimes we do testing for commissions. We've done that for a few different commissions that have asked us to test a fighter for an entire year. Those are usually when a fighter has had a prior adverse result. They want that athlete enrolled. We've done that for several MMA athletes, and then they're enrolled for the entire year and subject to testing. We have MMA fighters that we do that with, and that's usually on the basis of a commission request.
Okay. So on average, since we're talking about paying and cost, how much does testing cost on average since VADA tests for all prohibited substances?
It can cost, it depends on the location of the fighter, but typically there's a separate cost for the doping control officer or officers, depending on where they have to travel to, whether it's, South Africa or whether it's, Japan or any specific location in Europe or the US. There's the cost of that individual, and then there's the cost for the laboratory tests. The laboratory tests don't change that much because of the type of testing that we do, but the lab tests that the lab charges can go between, let's say, about $1,200 to $1,700 per test. Sometimes a little more, sometimes a little less. And that's because of the level of testing that we do. When you look at Olympic athletes that are undergoing testing per the World Anti-Doping Agency or WADA, in competition or out of competition testing, out of competition testing is approximately $200 per test, and in competition testing is $250 per test. And that's on average. Different commissions in different countries have a little bit different prices.
Right. So when you say out of competition, I've heard you mention that earlier. Out of competition is basically when the fighters or athletes in general are not competing. Maybe they're in training. Maybe they don't have a fight scheduled as of yet. Is that out of competition? Is that the meaning of that?
That's the meaning of it for all sports that are enrolled in testing, whether it's track and field or whatever. But what VADA has is VADA doesn't have out of competition testing. So, and by that I mean, even though we're testing leading up to an event or throughout the year, all our testing remains the same. And that means that we always include stimulants and narcotics in every test that we do. But they don't do that in the Olympic system. They only include those entities approximately 12 hours before an event or the night before an event and the day of an event.
Okay, got you. So there's a word that's been floating around here on this podcast, and it's been floating around on Twitter, or X, formerly known as Twitter, and that is the word that's always mentioned, not by you, Margaret, but by other people who promote VADA and fighters, and that word is stringent. We were told here, right here on live on this podcast, that the word stringent testing or stringent means once every 10 days. Can you confirm what the stringent testing in VADA testing means, stringent?
Gosh, I don't know. I've never heard anything mentioned in that regard. Basically, sometimes we'll test someone 2 days in a row. It just depends on on the program for that specific athlete. Usually, what happens is the promotional entity will give us a budget, and so depending on the budget, and you kind of now a little bit know the average cost. And that's, I gave you a cost without the doping collection officer that has to travel there. But on the average, if it's a fight, let's say if a fighter enrolls in our program 2 months before a fight, they may be tested 6 times, they may be tested 9 times, they may be tested 5 or 4 times. It just depends. But it may not be on an every 10-day basis, because then that kind of defeats the purpose. Then they know every 10 days they could have stopped something so they don't test positive for it. Right. So, so it varies. It just depends. I'd say what our testing is stringent in the sense that we test for everything every single time, whereas most agencies don't do the type of testing that we do.
Okay, gotcha. Because I was kind of confused on the word random testing. If VADA's website is stating that 8 weeks prior to a bout, fighters are going to be tested, and then you have the word quote unquote stringent, which means once every 10 days, that defeats the whole purpose of the random element.
Yeah, no, we never give that kind of frequency. As far as the frequency, it differs for every single fighter. It's never the same.
Right.
So
you spoke on you used the word promoters, and of course promoters pay for the testing. I just want to clarify something. We've heard this word on Twitter. Well, we heard it on this podcast, and of course Twitter, X formerly known as Twitter, this word muzzle. The audience have been told all around the world that there is what's called, and I quote, muzzle rule from particular promoters, specifically Al Heyman. I don't want to throw his name out there, but that's what we were told, that Al Heyman and you, Margaret, you and Al Heyman have this, I guess, muzzle rule where you are not allowed, or VADA is not allowed to publicize on a website any PBC fighters being acknowledged after they've enrolled in VADA testing. I think it's a great thing to be enrolled in VADA testing and be publicized, but most fighters are supposedly having a muzzle rule. Can you confirm that? What is all of that about?
I don't go by any term like that, and I would tell you that when a promotion or a commission has us enter fighter or fighters in testing, they can determine if they want that testing to be listed on social media. However, irrespective of something being public in that regard, the testing that we do always goes to many entities. In other words, if it is a promoter and it's a fighter leading up to a fight, then those results go to the fighter's opponent. They go to the fighter's promoter. They may have different promoters. That goes to the commission, goes to the Association of Boxing Commissions. And, it just depends. So, for example, in different commissions in the world, they may not want us to post something on social media, but that doesn't mean that all the appropriate individuals receive the results. So usually what we do, and there are several promoters that and it may be agreed upon in the fighter's contract. I don't know. I don't see the fighter's contract, that the fighter is able at any point in time to discuss their testing. But as far as the organization they're testing with, whether it be VADA or another organization, that they don't want us posting that on social media. So that's not really important to me. I mean, I know that some individuals would like to see everything in that respect, but even the U.S. Anti-Doping Agency or UCAD, they don't post results like that. So right. I don't think we're really any different in that regard. I I think the word muzzled doesn't make any sense to me. It's just basically there's several entities, and it does include commissions as well, that don't want testing posted on social media. I don't have a problem with that, as long as the right individuals that can adjudicate those results receive those results. So, for example, when we're testing for the clean boxing program, the WBC, they receive those results. The ABC receives those results. The fighter receives the results, as well as the fighter's promotional entity or manager. So, and the commission.
Yep, and I am fully aware of that. Of course, I'm a manager now. You, not the results itself, but the enrollment in the testing. We've seen it, and it's still live up here, where fighters that are enrolled in the testing protocol with VADA, and not just enroll, but actually complete the process, they're listed on VADA's website after testing is completed, right?
And that's true for athletes that want that to happen. Not every athlete, that may be in their contractual agreement that that's not something that they want. So if they don't want it posted on social media, we don't.
Not the testing results. I'm talking about just being enrolled. Like when you say welcome.
Enroll too.
Oh, okay.
Enroll too. That's
Okay.
up to the entities that are hiring us or contracting us to do their testing. That's certainly up to them.
Right. Okay, great. So when we talk about your involvement with VADA, we know that you founded it. We know that you are the president. We know that you were motivated by obviously seeing that horses, for lack of better terms, were being tested more than humans, basically. Um, but we were told that I guess you were introduced to the founder of WADA, Dick Pound, and that's how you got your start in VADA. Can you kind of clarify a little bit of that? That had some gray area that confused some people.
Yeah, no, basically when we were starting our program, we wanted it to be as thorough and advanced as possible. So Dick Pound and some other individuals, physicians that work with WADA, were very helpful in us setting up our policies and procedures so that we were comparable to the policies and procedures that are done by other anti-doping organizations, including with WADA. So that's basically how we started some time ago.
Yeah. So we do know that obviously WADA has the accredited lab, and WADA's code and standard and protocol is basically the standard. We also understand that VADA, you all outsource the work for the DCOs. Some people may get the impression, and we've heard this not on this podcast, but just in the public media for years, that VADA should be looked at as just a mediator. In other words, WADA has the lab that performs the procedures. WADA has the code and standard and protocol, and then you guys outsource the work to DCOs. Some people have said, not on this channel again, that VADA is just a mediator, and I don't know if that's a fair assessment. How do you respond to that, Margaret?
I don't really understand the term mediator, but basically what we do is we subcontract to a doping collection company that's pretty well, I'd say they're worldwide and well respected, that has certified doping collection officers through WADA that have taken those courses and are highly trained. And then we use only World Anti-Doping Agency accredited labs. So we don't adjudicate results. So if you want to say that we're I don't know about the word mediator. It doesn't make any sense to me. But bottom line is we act as the fulcrum, so to speak, so that everything can be carried out. So I'm not really sure what you're getting at, but
that was a term, Margaret. That was a term that was listed.
Yeah, I know.
Online.
Yeah, I don't. Well, I mean, I guess basically you could say that in a way. I mean, that's kind of what a commission does. They commission will hire doping collection officers. They may use their inspectors, or they may hire someone like us, and then they hire a lab. They don't run the lab tests themselves, and neither do any Olympic sports. So basically what happens is when individuals come to us, they contract us to do the testing, and then we're kind of the middleman in a way. Maybe that's what that individual meant, but we're kind of the middleman to make sure the testing is completed to the highest satisfaction, and the chain of custody is maintained, and then the highest grade laboratories review the results, and then the results are given to the appropriate parties for them to adjudicate.
Okay. So on the website, on VADA's website, there is a section where athletes, particularly in combat sports, they can click on this icon on the website and receive a piece of paper. And on the top of the paper, and I'm only setting this up like that because some people that watch this podcast, they don't have all of the knowledge when it comes to anti-doping. So I just wanted to clarify it for them. They've heard the term but don't know what it means. Can you help us understand the term on the piece of paper that says therapeutic use exemption? What is that, and what is the process for an athlete, particularly a fighter, to receive that from VADA?
So basically, that pretty much exists with every commission and every sport, I would assume, is that if someone wants to take a substance that's prohibited, they can apply for an exemption to have permission to use that substance. And so in order to do that, they have to fill out that form. And then once we receive that form, they have to submit medical documentation as to why that prohibited substance is absolutely medically necessary, and that there's no substitution of a non-prohibited substance. And then we have an independent physician review that and make a determination on whether or not that substance is permitted. And if it's not permitted, then they can't be in our program if they believe that that's absolutely necessary for them to take.
Right.
Because we're kind of a voluntary program in the sense that they don't have to be in our. But if they want to be in our program, we don't obviously want them to miss a treatment that's absolutely necessary. But if it's incongruent to what our prohibited substance list is, then they can't be in our program.
Right. And I think I saw something on the website too. Not even, matter of fact, it wasn't in the website. It was an interview that you conducted, I believe, in 2013. We were explaining the process of acknowledging fighters being enrolled in the program, and publicly acknowledge that when a fighter tests positive for a banned substance, they are removed from the website. I think that was your quote.
Yes, if they're listed on the website, they would be removed.
Right. So you did mention that, obviously we know this because you mentioned it, of course, it's on the website and it's in the name, voluntary. You all at VADA, you are a nonprofit organization, obviously a 501c3 tax exempt charitable organization. How do VADA receive donations, so to speak?
We can usually receive them through PayPal. That's probably the easiest. We also accept donations that are directly wired to us, but technically through PayPal is probably the easiest.
So is there a link, maybe someone that want to donate, I don't know, on a website, or how will we get access to donate to the cause of anti-doping in boxing?
That's really nice. Basically what I would do is whomever would like to donate, and like I said, it would be considered a tax-deductible donation. They can contact me directly at vada-testing.org, and depending on where they're located, I can tell them how it would be easier for them to do it, whether it's on PayPal. We're on PayPal as VADA, or the Voluntary Anti-Doping Association, or it can be directly sent to us via check or wire. It just depends on what the individual has. We have some individuals that send us on a monthly basis through PayPal. So it depends.
Got you. Okay. One of the audience members it's called Super Chat, where the audience members just pay to ask a question to the guest or someone that I'm interviewing, and I won't hold you too long with this because I know you have to go. The question was from Mr. Pragmatic. He asked, Margaret, in your opinion, how prevalent is PED usage in boxing? In your opinion, what's the percentage of fighters on PEDs?
I don't have a good answer for that. I would say that probably I would say 30 to 40%. I know other individuals maybe think it's higher. It just depends on, your frame of reference, obviously, because this is the so-called business that we're in. We think it's pretty high. I think some of that can be from lack of understanding and education, or just not wanting to take initiative on their own and taking whatever someone gives them, or they're actually trying to take a prohibited substance. I think it can vary on why that percentage is fairly high. I think more and more fighters are not using prohibited substances. I think that, I think we've helped that. I think that the other problem that we don't have time to get into is there's other substances that aren't considered prohibited that should be considered prohibited substances per the World Anti-Doping Agency and should be on their list. So that those are considered, would evoke an adverse test result. But that's a long story for another day. But
right.
But I think there's substances that should be added. And I think some of that can depend on what the laboratories are able to test for and determine whether it's, inborn, like endogenous, or it's exogenous, that they're actually taking something. So,
well, there's one that we've seen in a tweet recently, as even far back as last year and a few months ago, and even in recent interviews, where there is some sort of undetectable drug that there is no test for in the first place, called insulin growth factor 1, LR3, or long R3. Do you know anything about that, Margaret?
well, the only thing I can tell you is that it would be nice if that was something that would be able to be tested for. But once again, we're bound by what the lab capacity for certain testing is. And they can test for one of the components of that, but not all of them at this point in time, although I'm sure that they're trying to investigate being able to test for it, even though it's prohibited.
So just for clarity purposes, a banned substance, well, it's undetectable, but so IGF-1 LR3, there is no test for it, and it's undetectable, basically.
To my knowledge, yes.
Yeah. Back to 365 24/7 testing.
Okay, and I have to go in about 2 minutes
All
because
right.
I apologize. I just don't have the amount of time. We
Very
started late.
Very clear. We definitely did do that, and hopefully you can come back again, Margaret. Let me ask you this question. Most people wanted to know this. I'll just ask you right before you go. We've seen him mention your name in countless interviews, and most people didn't know who you were, and then people started researching you. I'm talking about Victor Conti. He says your name all the time in a recent interview, even with Jason Whitlock a few weeks back. What is his role with VADA? What is his role with the fighters? What is your relationship with him independently?
Sorry, I'm getting busy here. Bottom line is there is no relationship with VADA at all, nor has there ever been. He has been one of the first people that ever enrolled his fighters in VADA, so that was wonderful and contributed in that way. He's obviously very knowledgeable in anti-doping, but no role with our organization. We're completely independent of everyone, including promoters, athletes, commissions, and media individuals. So there's nobody that has any role with VADA.